discussing the topic of bone oncology here at ASCO 2012, and joining us to do it, Dr. Robert Coleman, Professor of Oncology in Sheffield, England, and he is the founder, I guess, do we call you?
Yes.
Of the Journal of Bone Oncology. So a little bit of craziness and a little bit of courage to start a publication like that in this day and age. What has the process been like for you?
It's been a challenge, but we're making great progress, and we're very excited about this new journal. First issue will be out next week, so we've obviously got enough content for that. And it's come out of the recognition that this was a gap in the market, which bridges traditional cancer research, oncology research, and research into bone diseases, which is usually run by our rheumatology and bone metabolism colleagues. And we've each published in each other's journals, but there isn't a forum to bring this very important area of cancer care and survivorship together. So we thought it's time for a new journal.
No, you said you've been pleasantly surprised by how it's been accepted.
Well, it's always difficult to get material for a new journal because everybody wants to publish in, the well-known top journals and want to get high impact factors for their original work. So initially we thought we would be, if you like, stuck just with some reviews, but actually people have sent their original research. It's all peer-reviewed, and we're not going to let rubbish in. This is high-quality research that we want to publish. But we've been very pleased with the material we've had. I think one of the keys to success has been to get a very strong editorial board, a global board of key names in the field, and that does count for a lot.
And you've done that?
We've done that, yeah. We have over 20 top oncologists and bone specialists really covering preclinical through to clinical care. And they're all engaged and committed in this process.
Gives you instant credibility right out of the gate.
Absolutely.
So let's talk about what type of content you might be seeking from people.
The remit is broad, so it's from preclinical biology type research in terms of the bone environment and how metastasis develops, through to treatment approaches, bone targeted treatments, interventions for bone complications like radiotherapy or orthopedic surgery, and then also the issue of survivorship, that many of our treatments damage the bone, and we want to bring what our osteoporosis colleagues have learned over decades about how to manage that into the oncology setting so that our patients don't get late complications.
So what is the process like for submitting content to you for consideration?
So this is an Elsevier journal, so it uses the standard Elsevier web-based submission process, and so you go online for the journal and access the author gateway, and we commit to do fairly rapid review. We'll do that in 2 to 6 weeks, and that hopefully, and our plan is to publish initially 4 issues a year. We don't want to be over ambitious because we only want to take the very best stuff. So 4 issues in the first year. After that we'll be able to get an impact factor, and we'll be listed on Thomson, and then that hopefully will pull in more material and we can expand if that seems appropriate.
Where does somebody go for more information, either to get their hands on the journal or to submit content to you?
Well, there's the website Journal of Bone Oncology. If you put that into Google, it'll come up. It's part of the Elsevier suite of journals. It's available through Science Direct. It's free for the first year. After that, obviously, there will be a subscription, but many people have access to the Science Direct suite of journals anyway, so you can look at it through that.
Best of luck on trying to fill this void, Doctor.
Thank you very much.
Appreciate it. Dr. Robert Coleman, starting the Journal of Bone Oncology, joining us here at ASCO 2012 here on Oncoview.tv. Thank you, sir.